Hello everyone. So today we are going to have a very basic video of how to apply eye drops. Some people may have some confusion regarding what is the best way to apply the eye drops. So this is for those people who are putting eye drops in other people's eyes, and I will also show you how to apply eye drop yourself, because some people say that we didn't have anybody at home so we could not apply the eye drops. So how can you apply the eye drops yourself? That also we will show today. Now, first of all, what you have to do is, you have to ask the patient to look up, because you can do it in sitting posture also. You need not, every time the patient need not lie down straight to put the eye drops. So just put the chin up, neck backwards, and you just have to pull the lower lid down and apply one eye drop. Only one eye drop needs to be applied. If you want, I can show you again. Just close the eyes. You can dab the remaining amount, whatever extra has come out, because some amount will definitely come out. So this is one. I'll again show you. Please look carefully. You have to look up, put the lower, pull down the lower lid and apply one eye drop in the lower lid without touching the tip of the bottle to the eyes. This is how you're supposed to apply. This is the best way to apply. And then whatever extra amount which has come, you can always wipe it off. Right? So this is the way to apply. Only one drop of any eye medicine needs to be applied in one go. 2 drops is a waste, because the second drop will automatically come out. So only one drop needs to be applied, one thing. Now if you have to use 2 eye drops, then keep a gap of at least 5 to 10 minutes between 2 eye drops so that the effect can be more. Second thing is, after applying the eye drop, the patient should keep the eyes closed at least for 2 minutes. In anti-glaucoma medication, another thing that you can do to improve the effectivity is to keep this portion, keep the eyes closed for a longer period and put pressure on this part of the eye. This ensures that the drainage of the drops is not taking place immediately through the small puncta in the eye, which ensures a better effectivity of the medication. So closing the eye for a little longer period than 2 minutes and keeping the inner angle of the eye pressed helps to improve the effectivity of medication, which is most important in anti-glaucoma medication. Also, for those people who are using drugs like 𝗕𝗢𝗢𝗡𝗧 or you're using travoprost or other prostaglandin analogs, there is usually a discoloration in this area of the skin, and it looks like you've applied kajal. There is darkening of the skin. So what you can do is keep a wet handkerchief, clean wet handkerchief ready. As soon as you have applied, clean it with a wet handkerchief so that minimum amount stays in the surrounding area and the discoloration is minimized. So that is how cosmetically you can take care of your eyes when using the prostaglandin analogs. Portion of the video would be to show how to apply an ointment in the eye. A lot of people don't know how to apply the ointment in the eye. They always have a query, how will we apply ointment in the eye? Because there are certain medications which are available in the form of ointment. So one thing which I want to show you is how to open. Now ointment has 2 parts. One is this opening, which will just show a closed covering. The second part is the actual cap. This is your actual cap, through which after pressing here, this will come out just like in a toothpaste. Now what you basically do is, you open the whole thing first, remove this ring. Now you have to reapply this and tighten it, right? Tightening it will ensure that you have punctured the seal. Now I'll again show you. See, it has opened now, right? The seal is punctured now. And then you just have to open the lid and look up. Look up, look up. Just apply this ointment, press it very gently and close the eye. That's how easily the ointment can be applied in the eye without any discomfort. So it's not that difficult to apply any medication. Now the last part remains how to apply the eye drop yourself. Food, the spoon goes into the mouth. I always tell my patients how the eye drop will come and go anywhere else. It will fall in the eye with the gravity. So what you have to do is, You have to pull the eyelid down, direct the eye drop bottle over the eyes and just press the eye drop. It will go in the eye. I can show you again. Pull the lower lid down, put the eye drop vertically over the eye and it will go in the eye. Sometimes to begin with you might feel that 1 or 2 drops are wasted, but once you get the hang of the procedure then it will go automatically in the eye. So it's not that difficult. So please start applying eye drops yourself and be less dependent on others for the basic needs and take care of yourself. Have a nice day.